Hello everyone, my name is Ruth Goff and this is going to be my presentation on COVID, healthcare access, and the advanced practice registered nurse. So advancing to slide 2, basically COVID changed healthcare delivery and healthcare access in the United States. I'm sure many of you were affected by COVID, whether that be personally or professionally. But it's pretty evident that healthcare really changed after COVID hit. The advanced practice registered nurse has been greatly impacted by COVID-19, and we will talk about some of the ways that they have been impacted. For example, telehealth, burnout, and mental health are just some of the ways COVID has impacted the advanced practice registered nurse. So those will be the 3 main topics that we'll be discussing, but of course there are several more ways that the advanced practice registered nurse was impacted as well. Okay, advancing on to slide 3. So telehealth during COVID just completely soared. It just skyrocketed. It did exist before COVID, but of course during COVID, it really became evident that a lot of people were going to start using telemedicine. Some of the positives is for the rural communities. They might not have access to transportation, and it might be a little easier for them to just log on online from their home and see a healthcare provider. Some of the negatives of this is that it's not as personal, and so some people don't like that as much. It's not as personal. Maybe some assessment things get missed because it's not in person. Not everyone might have access to internet, etc. Burnout increased during COVID. So this happened for the bedside nurse as well as for the advanced practice registered nurse, and there's a lot of literature that supports that. Mental health declined for patients and advanced practice registered nurses. That was a big thing as well. Mental health, because everyone was isolated, there were lockdowns, it really increased the mental health crisis that we have in the United States. Some ethical considerations would be things like family members not being able to see their loved ones due to trying to decrease the spread of disease. People had different opinions on that. A lot of socio-political factors, lockdowns, religious beliefs about vaccines, all those things need to be taken into consideration. Okay, advancing on to slide 4. So the plan for the advanced practice registered nurse is to really utilize telehealth and technology. It's not going to go anywhere, so we might as well use it to our advantage. They will continue to educate the population. So when we become advanced practice registered nurses, it's not going to be our job to change the socio-political opinions of the patients, but rather to educate them on good hand hygiene, the spread of disease, and kind of how to prevent these things from happening in the first place. And one really good resource is the county health department. That's something I use currently in my job to refer a lot of patients to there because they can get free vaccinations, free healthcare, and stuff like that. So that definitely helps with the access to healthcare problem. Advancing to slide 5. So in conclusion, COVID still impacts the advanced practice registered nurse today. Okay, it is better to adapt to change than to hide from it. So that's something I really want to emphasize, is that we really want to make sure we're not shying away from the technology. We want to be using that to our advantage because it's here to stay. And then the advanced practice registered nurse will continue to educate. It's not their role to change people's minds. That's not our role. Our role will be to educate the population as to best care for their health and well-being, okay? Moving on to slide 6. So these are just some of the questions that I thought about for further discussion. Number 1, how will telehealth/technology in general be used in your practice as an APRN? So this is something I want you to think about, how you're going to utilize either telehealth or just technology in general, whether you're in the family nurse practitioner track or in the psych nurse practitioner track. I think I forgot to mention I'm in the psych nurse practitioner track. So I definitely plan to be using telehealth, especially for like doing psych evaluations and things in my own practice. But how is it going to impact you, and how are you going to use that? And then what are some ways that you have seen COVID-19 impact APRNs and patients alike? So like I said before, I'm sure you've been personally impacted by COVID-19, whether that be, personally, professionally, et cetera. But what are some ways that you've seen patients be affected in the healthcare system? Maybe talk about the homeless population, how have they been affected? Talking about how the advanced practice registered nurses have been impacted because maybe the workload increased. Some of the things we already talked about, burnout, mental health, but maybe there's something else that you've noticed that has impacted the advanced practice registered nurse that has been a shift since COVID happened. Okay. So those are really my questions. And then slide 7 has the reference page. And that's basically the end of my presentation. I wanted to thank you so much for watching this video and reading my PowerPoint. Thank you and have a great day.